So, hello, my name is Michael West. I'm a senior visiting fellow at the King's Fund in London and professor of organizational psychology at Lancaster University in England. And I'm delighted to be talking this morning with my dear friend and colleague, um, Barbara Doeleman van Veldhoven, who is the founder and director of BFC Compassionate Care and Mindful Medicine in the Netherlands. Barbara, you and I have worked together for some time, and I am in awe of what you've accomplished in the Netherlands. Could you say a little bit about what you've achieved in the Netherlands over the last 10 years in influencing policy and practice to create more compassionate cultures in healthcare?
Sure, I can. And first of all, thank you for inviting me. It's really a pleasure, Michael. And first, I really want to say that this has never been a solo effort, of course. About a decade ago, I co-organized an invitational conference where we hosted you actually, Michael, and your work on compassionate leadership and the scientific evidence behind it gave language to, I think, what many of us already knew intuitively. Compassion can be disciplined, measurable, and it's central to human high quality care. And that moment really catalyzed a movement in the Netherlands. And since then, together with support of medical leaders, among them CEOs from hospitals who embraced this vision, such as Carina Hilders, Maurice van den Bos, Marielle Bartholomeus, Bertine Lahuys, and leadership expert and neuroscientist Jackie Bressy, who really helped move compassion from aspiration to operations. And concretely, we deliver nationally accredited programs for medical specialists and GPs. We coach hospital teams in shared compassionate medical leadership, and we run retreats that cultivate the foundational capacities such as mindfulness, presence, compassion, underneath all the behaviors we need for compassionate leadership. And alongside that, I give keynotes across the sector to build a shared vocabulary and momentum. And the impact, I think, is twofold. So practice, teams adopt micro practices that protect time to care and psychological safety, and policy by securing accreditation and partnering with hospital boards. Compassionate leadership is now recognized as part of professional development and leadership standards. So in short, we've built capability, legitimacy, and a community that keeps improving care and sustaining caregivers.
That's really impressive breadth of activities and influence. And I guess what I heard in what you were saying was that some of the really important elements that help you to influence policy and practice are things like having an evidence base, but also, the content of what you're sharing is intuitively right. People feel it intuitively that this is the right thing to do. You've formed teams around you of people who can work with you, so it's not just you alone trying to influence practice. It has to be a team of people. You've had the support of senior leaders, and you've worked with boards and senior leaders as well. Multimodalities about the way that you seek to influence. So not just leadership training, but retreats, team working, and so on. So multiple modalities. The importance of presenting again and again and again to influence policy and practice. And also I heard, and we've heard this from other people who've been really effective, the value of accreditations as well. So I think those are really important lessons for how we influence policy and practice. So maybe you could just dig down a little bit deeper and talk about how you've gone about all of this. Describe the steps, if you would.
Beautiful question. And I think in the beginning, it all starts in this, what you mentioned also, is that we all know that we can only deliver high quality human care if compassion is beneath. So it really begin with this aspiration to contribute to compassionate care and human care. And I began teaching medical specialists and GPs in programs on compassionate medical leadership, and early on, and I saw a clear pattern. Many became because they were already struggling. Moral injury, empathetic distress, burnout symptoms, and it really struck me. So why are we only learning these skills when people are already hanging by the fingers on the cliff?
Mm.
And this cannot be just about fixing individuals. We have to address the system. So that realization shifted my focus to leadership. And around that time, I invited you, Michael, to the Netherlands. And your framework gave us a language and evidence to work with leaders directly. And crucially, I was not doing this alone. I want to emphasize that again. People like Carina Hilder, who is a professor in medical leadership, publicly said
And
this.
also CEO of, I think, the biggest hospital in the
Yeah,
Netherlands. Yeah.
that's true. Yeah, that's true. And she really stood up and said already 10 years ago, this is the way we need to go for sustainable healthcare. And having such senior leaders and CEOs actively endorse and walk this path made the work possible. And the Federation of Medical Specialists then invited me for keynotes, embedding compassionate leadership into the leadership vision for hospitals. And between individual clinicians and executives are, of course, the teams. So at one keynote, a doctor asked, can you help us to strengthen our shared leadership in our team? And that became the seed for our accredited team training programs. And over the last years, we have trained a cohort of facilitators, mainly medical specialists, alongside other healthcare professionals who now deliver these team trainings with me. And this allows us to reach far more hospitals and make impact truly systematic. So today we work across 3 interconnective levels. 1, professionals, accredited for specialists and GPs and nurses. 2, teams and departments, accredited training in shared compassionate leadership. And 3, leaders. So executive coaching, board engagement and strategy. And because these skills are reinforced at all these levels, the culture change is more sustainable. So yeah, I think this is in short the way we went actually.
So it feels really important in our conversations generally about influencing policy and practice that we recognize, as you say, that it's not simply about focusing on individuals, but focusing on how we create compassionate systems.
Absolutely.
And again, that's, I think, been a theme in Wales, where Health Education and Improvement Wales have focused on how to transform the system, not just put in place supports for individuals. And as you say, thinking about the different levels, so professionals, teams, and the leaders who play such a powerful role in influencing the culture and the systems in the organizations. And Barbara, what would you say have been the big successes?
Hmm. Um, I think when I look back, the biggest success is a cultural shift. 10 years ago, if you mentioned compassion and leadership, many would smile politely and say, well, dream on. First, we need to fix the finances, the workload, the staffing crisis. And today, there is a clear recognition that compassionate leadership and awareness are not luxuries, and they are the foundation for addressing those very challenges. So we now speak of them as qualities we can deliberately develop in healthcare, and this is broadly embraced across the sector. And there's a shared vocabulary, a growing evidence base, and nobody raised an eyebrow anymore. And
Mm.
that to me is the greatest achievement and source of hope for the future, actually. And
Mm.
on a practical level, we have built momentum at three interconnected levels. One is, and these are the same three I mentioned before, are the professionals trained in the accredited programs, the teams and departments that that trained in shared compassionate leadership programs, and that is delivered by the trainers, the facilitators, and three, the leaders. So hospital boards and executives actively integrating compassionate leadership into organizational strategy, culture, and leadership frameworks. And now we are moving beyond training into embedding compassionate leadership in core systems. So contributing to leadership frameworks, shaping recruitment and selection processes, and integrating compassion into feedback and performance dialogues. And this makes it a part of policy, so not just a project, but really sustaining the culture change for long term.
Mm. So it's building it into the DNA of healthcare organizations and healthcare systems. And
Yeah,
I think what's really amazing is how big a culture shift there's been as a result of all of this work that you've been doing. And also, I guess the other implication, in a way, one of the takeaways for influencing policy and practice is, as you said, people say, well, first of all, we've got to fix the finances, the staff shortages, the problems of retention, the problems of staff burnout. And actually, the message you've been sharing is this is the way that you fix these
absolutely.
problems. This is the way that you address those problems. If you focus on the problems alone, the problems are going to get worse.
I'm
But
yeah.
addressing the underlying culture, if you like, watering the roots of the culture and the system is how we're going to achieve change. And undoubtedly, there must have been some really big challenges for you along the way. What have been the main challenges you've had to face, and how have you dealt with
Yeah,
those?
yeah. And before I go to that question, Michael, I would really thank you for all the work that was so helpful for delivering evidence behind the words or beneath the words. That was so helpful to really show people that this is the way, and also to these complex challenges we face. So, about the challenges I faced in my journey, is I think it was one of the biggest challenge was that it was really a new field in the Netherlands, and of course compassion is not new because compassion is in the DNA of humanity, I think. But integrating trainable qualities like mindfulness, so awareness, attention without being judgmental, deep listening, and really compassion into leadership. This was quite new. And at the outside, the challenge was to overcome skepticism and get doors open, and showing that these qualities are not vague ideals but concrete, learnable leadership competencies. And another challenge was how to create the greatest impact with something so new. So especially when very few people here had deeply trained these capacities in themselves. And compassionate leadership has both, as you know, practical and technical elements, and deeper cross-disciplinary human skills that only can be developed through personal practice. So finding people who could bridge those two worlds was not easy. And of course, there are those people. So I really realized we needed to build from the inside out. And that led me to recruit a group of 8 healthcare professionals, including several senior medical specialists, to work closely with me on shaping an accredited team training format for departments. And together we integrated a set of practical, high impact behaviors. So like micro practices, arrival huddles, structured listening in high stakes conversations, and peer coaching. And because we co-designed and tested the approach within their own professional context, the results were credible and directly relevant. So fewer frictions, smooth handovers, more constructive challenge in meetings, and stronger sense of shared ownership. And their involvement also created natural ambassadors for the work, helping spread it out without losing quality. And if I may mention another hurdle, that was accreditation. So in the early days, approval could depend on the individual committee members, some of whom were unfamiliar with the evidence base, and it took persistence, credible allies, and demonstrating impact to get consistent recognition. So now that accreditation is more stable, it's strong lever for legitimacy. Oh, this is really hard for me. A hard word for me. Please help me out.
No, thank you. The legacy of the work.
Yeah, and adoption.
Yeah, and
Thank you,
adoption.
Michael.
Yeah.
So this is a challenge for me too, to do
Yeah.
it internationally.
No, I appreciate that you're doing this in the language that isn't your native language, and it's so fascinating and so compelling, and I'm particularly struck by the importance of persistence, and I think we use that word and often don't understand that what underlies it is courage, the courage to keep going, the courage to persist, and creating a network of allies, as you describe, so that you can scale up this process of influencing policy and practice. And given, we've talked a lot about the successes and a little bit about the challenge, what do you wish you had known, looking back, what do you wish you had known at the outset? And what would you wish for now that would help the work that you're doing?
Yeah, and I really liked what you said, Michael, that it's also, I think compassion is about courage and showing up and really move towards the uncomfortable sometimes.
The unknown,
Yeah, and the unknown as well. So at the outside, I wish I had understood even more clearly how essential it is to start at the policy and leadership level. With leaders who dare to think beyond their own term in office or the boundaries of their own hospital. And from the beginning, this work needs to be framed as investing in the fundamental blueprint of healthcare. And compassion has always been this blueprint. And looking for the future, the challenge is to keep that long-term perspective alive, especially when stress, financial pressure, staffing shortages narrows our vision and pushes us back into short-term control, which is very human. So true leadership, I think, is about holding the course, even under pressure. That's why it's encouraging to see the Federation of Medical Specialists in the Netherlands integrate compassionate leadership into their 2035 vision, and equally heartening to see nursing leadership, not to forget about this, gaining more visibility and embracing this approach alongside medical leadership. And for the next phase, my wish is for concrete systemic commitments, protected time in rosters for time for team connection and reflection, to board member commitment, making compassionate leadership a common expectation. 3, embedding compassion in HR processes from recruitment to feedback cycles. 4, a national competency framework to these skills. So these skills are in all healthcare education. And 5, long-term evaluation funding to track impact over years. And if we achieve that, compassion will be embedded in the structures, not just in individual champions. And that's the only way forward, I think, because care can only be delivered together, and sustainability can only be built together, and the future can only be created together.
So those themes, some of the themes you mentioned, Barbara, I think are really important. I've found that we have to work with boards initially to have their backing to affect the cultural changes, the cultural shift. But I'm also struck by what you say about time, teams having time to come together to reflect, because there is this huge tension between productivity,
Absolutely.
cutting waiting lists, seeing the number of patients we need to see, and innovation. You know, the only way we're going to be able to deliver for the people of our populations is if we take much more innovative approaches to taking care of people's health, preventive approaches, more care in the community, more integration between agencies. And that requires the time and the space for people to come together and have the difficult, compassionate conversations about the tension between productivity and innovation, but also the point you make about presenting a rationale. And I increasingly present a rationale that says, you know, we're here to ensure the happiness of the people of our communities, of our countries, and our physical and mental health of them. That's the number one factor.
Absolutely.
Followed by relationships at home, work, in the community. But our happiness is dependent on the happiness of people around us. And healthcare is, you know, healthcare sector, I think, is the most important agency in our society for influencing that happiness and well-being. So having that profound and important rationale, I think, to present to leaders, along with the evidence, as you say, just helps enormously. I think the lessons that you have, the themes you've identified, the lessons you've offered through this conversation have been really powerful. And I know people will likely want to get in touch with you. So I hope that you will say they're free to get in touch if they'd like to learn more.
Of course, I would love to get in touch with people who want to bring this forward. And I think, I couldn't agree more with what you said before, Michael. And I think that healthcare is really one of the foundations under civilization, under beneath how we live with one another in this crazy world. And of course, I want to thank you personally, Michael, for your unwavering commitment to putting the heart back into healthcare and for making,
Thank you, Barbara. I mean, it's as you know, this work is a privilege, and it feels like a privilege for me and a privilege to work with you. And thank you for this amazing conversation this morning, which I know will be helpful to so many people. And thank you for all of the extraordinary, amazing work you do. I know it's tough at times, but you're having such a huge impact. So thank you very much.
Thank you. Feeling very grateful for all you do and all the people who bring this forward. And if people would like to get in touch, they can find me on LinkedIn, but they can also send me an email by barbara.doeleman@ccmm.care. So I'm happy.
And you have a website as well,
Yeah,
which is www.ccmm.care. www.ccmm.com. Care.
Care. Yeah, that's it. Thank you, Michael. Have a
Thank you,
beautiful
Barbara.
day. Thank
Thank
you.
you. You
Bye.
too.